Health workers across Nigeria have embarked on an indefinite and nationwide strike beginning from Saturday. The strike was declared by the joint health sector unions and the Assembly of Healthcare Professional Associations on Friday, warning the government against any form of intimidation or victimization. The union cited the federal government's failure to implement the adjusted Consolidated Health Salary Structure, along with unresolved welfare and systemic issues, as the primary reasons for the strike. In a statement signed by JOHESU National Chairman Kabiru Minjibri, the unions stressed that prolonged government inaction left them with no option but to withdraw services. Now, the General Secretary of JOHESU, Martin Egbanubi, joins me now for more on this strike situation. Thank you so much, sir, for joining us.
Thank you so much for having me.
So let's understand what the final triggers were that pushed JOHESU into getting, of course, into this indefinite nationwide strike that we are seeing playing out.
Thank you so much. The current issue with the joint health sector, JOHESU and the federal government has to do with an age-long demand for the adjustment of the Consolidated Health Salary Structure, which has been a demand since 2014, when there was an adjustment on the Consolidated Medical Salary Structure for physicians. And of course, there was a collective bargaining agreement that was signed with government in 2009 that established the two salary structure. That whenever there is an adjustment on either of the salary structure, there must be a commensurate adjustment on the other. And that is the issue since 2014, when the adjustment was made on comments without any adjustment on CONHES. And CONHES covers other health workers like pharmacists, physiotherapy, nurses, and other health workers apart from even those in the administrative departments and other sections of the hospitals. So the issue now is that we want government to implement a high-level body committee reports set up by the federal government for the adjustment of these CONHES, which had been submitted in 2022 to the Secretariat of the Presidential Commission on Salaries, which is the budget office of the Federation. And so what we need is for federal government to give approval to this report and then implement the recommendation of the report, which has to do with the adjustment of the Consolidated Health Salary Structures. Thank you.
Well, we understand that there have been several engagements with governments before now. How would you assess government's earlier response to this?
Well, so far we've not been able to get satisfactory response from government vis-a-vis our past experiences with previous governments, because under Goodluck Jonathan, there were a lot of commitments, verbal commitments, but what we need is a commitment that has to do with issuance of circular and tables for the implementation of this adjustment of this salary structure. In the past, there have been a lot of verbal commitments in the Goodluck Jonathan administration, in the immediate past administration of the late President Muhammadu Buhari. And so what we want now is for government to commit ourselves to the proper establishment procedure by giving approval to this recommendation of a committee set up by government. And this committee has submitted reports in 2022. And so we expect that the report of this committee is approved and circularized with tables. So that is just the demand we want now. We have had several engagements with government. Trade disputes have been declared severally. And we have had to go to ADIA on this matter. We have had issues to go to the National Industrial Court on this matter. So now what we want is the commitment of government via establishment procedure to ensure that the needful is done and the payment is made. Because we don't want a verbal commitment to say we will pay and there is no document back is sort of. Thank you.
All right, so critics actually argue that strikes for the weakened and already strained health system. So how does JOHESU hope to balance worker welfare demands with the potential impact on patients and public health?
So thank you so much. On our part in the joint health sector unions, comprised of about 4 unions with highest population of health workforce. That is the medical health workers, Nigerian Allied Professional. We have South Tribe for teaching, those who are in the union for teaching hospitals. And of course, we have NASU. So for us over the years, we have been magnanimous in terms of trying to identify with the masses, because you cannot see us withdrawing our services just like that. We take our time to do that, and we always ensure that we conform with the provision of the Trade Dispute Act, the relevant provision of the Trade Dispute Act. However, JOHESU always weigh public opinion and sentiment before embarking on strike. These strikes are becoming inevitable because we have utilized the instrumentality of social dialogue to resolve this issue in particular. We have had several engagements, and we've not been able to get enough conviction on this matter from the government, enough commitment that will convince us that government is serious at addressing this issue that have lingered on for, over 12 years. So I think it is important that the people, especially well-meaning Nigerians, understand with us that we are not unions that embark on strike just for the sake of it.
Okay.
We embark on strike because we have exhausted all machineries, internal mechanisms for resolving some of these disputes. We have exhausted it.
Well,
and so we have no option than to
well, we just hope that this can get resolved soon, right? We must say thank you to Martin Egbanubi, General Secretary of JOHESU, for sharing your thoughts with us. Now, coming up on the news.